Welcome to week 32 of the MamasteFit pregnancy week by week update. In this video, we're going to discuss what is going on with your baby in week 32 of pregnancy, what might be going on with you, and then I'm going to be sharing what's going on with me and my personal journey because I am pregnant with baby number 4 and I am 32 weeks pregnant. Before we dive into what to expect at week 32 of pregnancy, I do want to share that my book, Training for Two, is now available for pre-order, and the book comes out on September 10th of 2024, so depending on when you're watching this, the book may be available now. The book is all about how you can use prenatal fitness to help support a strong pregnancy, a pain-free pregnancy, and then also to prepare for birth, which is what a lot of us are starting to focus on in the third trimester. So you can check out Training for Two down in the notes below. So Roxanne, what is going on with baby in week 32 of pregnancy?
So week 32 of pregnancy, you have approximately 2 months left of pregnancy, give or take a week, probably more for Gina, maybe less for you. Baby is the size of a Care Bear stuffed animal or a bunch of celery. So whichever one kind of resonates with you. I think it's called a stalk of celery, maybe.
I think a stalk is a single one, and then a
And then
bunch is a
is
bunch
like
of
a
them
bunch of them
together.
together. So whichever one, the size-wise, gives you the size of your baby. All of baby's organs have fully developed at this point except for their lungs. Their lungs are the organ that continues to develop until baby is born. So the main thing that they're doing starting around 32 weeks is practicing for living outside of the womb. So they're practice breathing, they're practicing swallowing to kind of prep their digestive system, as well as those lungs so that they can live on the outside. So the one thing that we can do during the third trimester and that is recommended is continuing to do those kick counts. And again, there are 2 different ways to do the kick counts, but the best way is to notice baby's natural movement patterns, normal movement patterns for them, and then notice when there is a change to that. Count the Kicks has an app that makes it really easy to kind of track baby's intuitive movement patterns as well, so that you're not like writing it on a piece of paper or like writing it a note. Sometimes having an app can make it a little bit easier to use. So that's really all that's happening with baby. But for you, there are lots of things that could be happening with all of the same pregnancy symptoms of the heartburn, constipation, insomnia are continuing as they were all of pregnancy. But one thing that you might notice now is you might be nesting more. So nesting is preparing your environment for a baby. So you're creating a welcoming space for your baby, whether that's through just cleaning your house, organizing your house, imagining and preparing the nursery or like planning what you're going to put in the nursery. Some people, it's just like creating your baby registry is nesting. So you're just creating an environment to welcome a baby in. So if you're in the middle of moving, it makes it a little bit harder to nest because obviously you don't have a space to prepare, but you could be preparing your body and your mind as well with nesting. So Gina, are you nesting at all
I'm
right
deep
now?
cleaning my entire house. We have picked different rooms of the house to deeply organize, like closets, really important places the baby's going to definitely look first.
Yeah. Yeah. Definitely gonna look underneath all of the
They
mattresses,
are.
every single, like, cabinet, dresser, just to be like, "Did you prepare this?"
We don't want her to show up and be like disappointed with what our house looks like. But we have been like organizing and deep cleaning, spring cleaning essentially,
Yeah. Well,
getting
it's
rid of stuff
spring.
that we don't need, and then also hunting for the stuff that we need for the baby that we have
Stored away.
mislocated over the past 2 years.
Yes, I was moving, so, it was really hard for nesting for me. It was very hard. That's what I did the entire day before I went into labor is I organized my entire house, put a bed together, and that's probably why I went into labor because I was dehydrated. Another thing you might notice around 32 weeks is that your dreams are getting wild. You're just having some really weird dreams. And this is just due to like your sleep disruption. So either you're sleeping just like really weird times or like not able to sleep. And then when you do fall asleep, you have like these crazy dreams that might like even wake you up. They're like very vivid. And this is just due to, again, those sleep changes as well as the hormones of pregnancy. So some people find keeping a dream journal is really cool. So when you wake up, you write down your dreams just so you can like look back on them and be like, wow, that was a really crazy dream. I thought that was real life, but it was just a dream. And then the last thing is around 32 weeks, your provider might offer what's called the RSV vaccine. RSV is a virus that can affect our respiratory systems for us as adults and doesn't normally affect us too terribly, but it can affect babies and young children where they might even have to be admitted to the hospital to be monitored. So you can get this vaccine during pregnancy to help create those antibodies to help protect your baby for up to 6 months of life. So this is an option that is now available to pregnant people are around starting between 32 to 36 weeks. So you can build up those antibodies similar to the Tdap vaccine that you can discuss with your provider as an option. We also want to be monitoring for any signs of labor because 32 weeks, so all of the organs are developed. So if baby was born, they'd be fine, most likely. But we do want to avoid preterm labor and preterm birth if we can. So noticing the signs. So if you start having consistent contractions that are painful, increasing in intensity, and starting to have like a pattern, this would be signs to call your provider. If you start noticing any bleeding that's heavier than just spotting, as well as if you feel like you like potentially lost your bag of fluid, so like it ruptured, those would all be reasons to call your provider potentially for signs of preterm labor. But that's really it for 32 weeks. But Gina, other than nesting and organizing your entire house, how are you doing?
I am beginning to feel the discomforts of pregnancy a lot more. So I'm not like in pain where I can't walk and like function, but I am noticing a little bit more like tweakiness, especially to like my right SI joint. So I have increased my self-care. My self-care budget has increased in the last trimester. So this past week I saw a Webster certified chiropractor because they specialize in helping to balance the pelvis and the uterus, especially. So we'll do like a sacral adjustment. He'll also look at like my round ligaments and the broad ligaments to kind of help ensure that the uterine position is doing pretty good. Because I also have a little baby in there that is impacting my comfort also because she likes to be in certain positions. So that was really helpful. I also saw a cranial sacral therapist and she did like a massage to reset my nervous
She gonna
system.
get some massage weekly, I
I
think, at
do.
this point.
I do. Or it's like every other week, but I refer to it as like a nervous system reset. And so it's a much more subtle massage. It's different than like the deep tissue ones that I get every other week now. But when I get up off the table, I can really feel that there's something different like within my body, which I really like. So I got that this week. And then we also had a home visit with our home birth midwife. And so she came to the house. She kind of makes sure she knows where to go. She's been in our house before though for previous births. And we just kind of start making sure that we have all the things we need, like the birth supplies. So she'll bring a lot of the equipment that she needs, like anything to help with resuscitation, like medications, things like that. But like we essentially have all the medical supplies on hand that's not like medication. So gloves, Chuck's pads, more pads, lots of pads.
Yeah,
And
an
then
entire box of
just
just
lots of
pads.
pads. And then we're also trying to get all this stuff ready for baby as well because we're like, oh yeah, we have to have clothes for her and receiving blankets
And they're
and things
probably
like
all at my house,
that.
honestly, sitting in a
So we
bag.
are starting to. That's like a big part of our nesting is figuring out where all the things are in our house.
They're probably at my house.
They're probably at your house. Sleeping has definitely been harder, which is not surprising. I think this is the first pregnancy where I really struggled with sleep a lot more. The cooling blanket has been helping. Lots of pregnancy pillows have been helping just for me to be comfortable as I sleep. But falling asleep and then staying asleep is a little bit more challenging. I have a little Whoop watch that tracks my sleep, and it's like, you're in sleep debt. And I'm like, that's fun. So
Your
even
sleep bank
so last
empty.
night, I think I was
Negative.
having dreams that I was not sleeping. And so I woke up even more fatigued and confused because I was like, was that a dream or did I not actually sleep last night? Like, surely I must have slept, but either I had a very vivid dream that I had insomnia or I had insomnia. So who knows? But overall, like feeling pretty good. Workouts have been really consistent, still doing the MamasteFit strength program. And what's really nice is our program syncs to your current week of pregnancy. And so it's giving me specific modifications for this time. And so I've started to kind of adjust the way that I've been lifting. I have a lot more support with my movements. So instead of doing like a back squat, I'm doing a box squat. So I'm squatting down to an elevated surface, which is kind of decreasing the range of motion to make the movement more comfortable for myself. Deadlifts are elevated now so that again, decreasing that range of motion so it's more comfortable. And then I'm also incorporating a lot more like birth preparation exercises that really focus on like hip mobility, releasing tension within the pelvic floor. And then also a lot of SI joint specific exercises to help balance my pelvis because I don't have to be in pain and I would like to not be in pain. And so I'm definitely taking a lot of measures to help limit the amount of discomfort that I'm in. Although I haven't quite figured out the insomnia thing. Maybe that's just something that you have to have during pregnancy.
It's preparing you for the sleep deprivation of postpartum.
It is just training.
Training you to be awake all night long.
So thanks so much for joining us in week 32 of what to expect during your pregnancy. If you're pregnant, be sure to comment below to let us know how you are feeling. And if you have the solution for pregnancy insomnia, let me know. I would love to know what your advice is. If you want more support throughout your pregnancy, check out our online prenatal fitness programs. We offer our online prenatal fitness programs in two main formats. We have our app-based program, which is one that I am currently following and what we do with our clients in the gym. And this is going to be a list of exercises with short demo videos. And this is going to be a self-paced workout. So if you enjoy working out in a gym setting with a barbell, this can be a great program option for you. But if you prefer to follow a video as you work out at the same time, we do have our Prenatal On Demand program, which are full-length workout videos. If you already have a workout program that you're doing and you're like, I love this program, I don't want to join yours, we do have our birth prep workouts as a standalone program as well if you just want to grab that, so you can make sure that you're doing all of the movements that you need to create space in your pelvis, release tension within your pelvic floor. And the good news is you can start our programs at any time, even in the third trimester. The app-based program has a monthly payment option where you just grab the months that you need, syncs to your current week of pregnancy. And our on-demand program has a third trimester option, so you can just grab the third trimester for this last little bit.
And if you're looking for an education course, check out our online childbirth education course where we discuss the science of labor and birth to help make it less mysterious and less scary for you to approach during labor. In the course, we break down different birth interventions, different birth options, as well as what your partner can do to help support you during labor and birth. And you can use code YouTube10 to get 10% off any of our offerings as a thank you for listening to this entire video. You can use it on our prenatal fitness, our childbirth education, or even any of our postpartum programs and education courses. And you can check out all of our offerings at MamasteFit.com.